Dental Health for Arlington was created as a result of a community needs assessment conducted by the United Way in 1990. That survey showed that the complete lack of any sort of free or low-cost dental care was one of the top 4 needs in southeast Tarrant County. The Arlington Human Service Planners, a branch of the United Way in the city of Arlington, put together a study committee to research the problem and decide what could be done to solve it. After almost a year of study, they created a board of directors and gave birth to Dental Health for Arlington. The first need that was addressed was to create a clinic. Mission Arlington sat on the study committee and offered a little duplex building that was not being used on one side and suggested it could be used to build the clinic. Several dentists noted that they had remodeled their offices and had used dental equipment they would be happy to donate. Others noted that they had dental instruments not being used any longer and would be happy to lend those towards the effort. Dr. Alan Sachs and the Junior League of Arlington pitched in to donate funding that was used to purchase items that could not be donated and to aid in the remodeling and plumbing. Slowly but surely, all the pieces came together and the Alan Sachs Dental Clinic opened its doors for the first time on April 16, 1992.
It's been a great joy. It's been a huge amount of fun and a privilege to work with just a fantastic group of board members and volunteers and staff members that have put this project together. It's just been so much fun to be part of something that at the time we started was really quite groundbreaking. There weren't any other projects like ours, and we've helped a lot of other people with information on how they could start projects of their own. And as we slowly but surely came through the years, and you go back and look at the numbers and the people that have come through our clinic and the kids in our school programs, it's just been so much fun and so rewarding to see the great numbers of people that have been helped.
They actually made a pretty good scientific study, and the results came up. There's an overwhelming need for all sorts of dentistry in Arlington for people that cannot afford it. And that's how it proceeded. And it happened very quickly. From the actual discussion and the study made to the actual event was a very, very brief period of time.
My small role has been very gratifying in that people say thanks, and I'm not the one they need to thank. It's just wonderful to be a part of something that's so successful, to meet such a tremendous need in the community.
I just came out of good fortune. My mother passed away, and I was thinking in my mind, she would have loved some of that money to go to the dental clinic.
The Alan Sachs Clinic benefits disadvantaged residents of all ages who have economic needs to receive free treatment. Medicaid does not provide dental benefits for adults, so the very poorest of our poor adults have no place to turn for treatment other than the Alan Sachs Clinic. Children, too, have very few resources for low-cost dental care, especially the undocumented. We see patients of all ages and ethnicities. Services available in the clinic include those you would find in most any dental office. We also have a denture program that we believe is one of the most important things we do.
Our senior citizens that don't have teeth, it's a health thing. They can eat and take care of themselves physically, not to mention the ability to get a job because your front teeth are there now. Oh, they're so excited. They're so excited. If you've ever seen our pictures in the front room, those are the happiest smiles you've ever seen. I've taken pictures of people sitting here at my desk and they look at the picture and they'll start laughing. They said, I haven't seen myself smile in 18 years because I haven't had teeth in 18 years. And they just really get moved. They're so excited and just happy to have teeth for once. Pedro came to us a very unique way. He is a dentist from Cuba, and he obtained political asylum to come to the States. And so he cannot practice here in the States because he doesn't hold a license. But I said, we could use you as a dental assistant. You can do our laboratory work. You can help us with all of our OSHA and all of our cleaning of rooms and such. And so that's what he joined us probably 2 years ago now in doing just our assisting care.
Another is a retired Air Force dentist who volunteers to extract teeth necessary to prepare a patient for dentures.
These people can't afford to go to a civilian dentist. So this gives us an opportunity to give something back to them. It gives me an opportunity to give back to the community, something I couldn't do when I was in the Air Force. Anytime that I can make somebody's lifestyle a little bit better, for whatever reason, that's a feeling of satisfaction to me. It is a pleasure for me to come work with such dedicated people here. I know I can't say that enough, but I will place the fellow dentists that volunteer here amongst the best that I've ever been associated with in my lifetime. And I've been a dentist for 36 years.
Since the doors opened in 1992, the clinic has been remodeled twice thanks to Mission Arlington. It has now grown from its original 2 chairs to 6 full dental operatories and a small dental lab. In the beginning, almost all of our services were provided by volunteer dental professionals. We still have every Friday as Volunteer Day at the clinic.
I'm glad to help them out because there is a need out there and people are in pain. It's just really great to help them out and get them out of pain and do whatever restorative work is necessary for them to have the healthiest smile that they can. For example, when a person comes in like with the 2 front teeth chipped off, and they're coming in like, I'm really embarrassed to smile, or really embarrassed to talk in public and be seen by other people. And if they're chipped off and I take the time to build them up and to form that tooth, and then they look in the mirror, it's like, oh, this looks good. So it's really good. And when they either shake your hand or give you a big hug, that's the best thing.
They don't have to advertise. People tell their friends and their friends tell their friends who are needy of this service, this is where you can go. And it's just such a wonderful group, such a wonderful opportunity for the citizens in need in Arlington to access this kind of volunteer activity. It's very gratifying.
It's a crowded waiting room, a lot of children out there, and adults as well. And it doesn't seem like anybody's scared. I mean, really, that's the amazing thing about it. You know what I mean? Nobody's sitting around. You go to a usual doctor's waiting room, a dentist waiting room, and everybody's very stilted. They're reading the magazines and everybody's sort of tense, and everything like that. I am. I know. If I go to a dentist, oh man.
Many of our area dental professionals have been a very important part of making the Alan Sachs Clinic a success.
People up here don't know my name, but they call me Santa.
He looks like Santa Claus. Even his cell phone goes off, it plays jingle bells. So this is a man that goes into the community and around Christmas time plays Santa Claus.
Dr. Bo, I wish I knew him before, because the guy's great.
He had some problems with his teeth and didn't know what to do. So he came to us saying, can you help us?
I had all these teeth pulled on top, took 1 pain pill. Had all these pulled on the bottom, no pain pill.
Soon after the clinic opened, the terrible conditions the dentist found in the mouths of children led to a second phase of our program. The dentist knew that tooth decay was an almost entirely preventable disease. They were terribly distressed to see so many kids coming to the clinic with severely decayed mouths. A school-based preventative dental program was created. It began as a pilot project in 2 schools in 1994. The first year, the dentist screened 386 children, and 83 sealants were placed. Since that time, the program has expanded to 24 elementary schools in Arlington and Mansfield. Today, approximately 6,000 area students annually receive oral health education, and more than 6,500 sealants are placed each year.
When the clinic was open, we were seeing children in our clinic that had severe decay rates. So in order to try to stop the decay where the process was, we developed the SMILES program, and our initial goal was to educate the children, and put sealants on a molar and maybe stop the decay rate at that time. And our mission was to basically increase overall health by decreasing decay rates.
Well, we were really excited about having the program here. We have so many students that come into us that are students of poverty, not only from our own country, but we have so many immigrants that are coming from Mexico and other South American countries where they probably have never seen a dentist. And so this gave an opportunity for those kids to really have an examination and then get some sealant on those teeth. So we were really excited about it.
I guess the most dramatic thing when we do the exams, when we go to the school program and we check kids' teeth, it's really exciting to see the kids that we saw the year before, and they come in and their teeth look good, the sealants that we placed are there, and they've actually got healthy teeth, whereas they might have had big cavities if we hadn't seen them the year before.
The school-based preventative program is known as SMILES, which stands for Sealing Molars Improves the Life of Every Student. The SMILES program benefits children in Arlington and Mansfield elementary schools having 50% or more of their students on free or reduced cost meals. It provides dental health education, oral screenings, and placement of dental sealants. The goal of this program is to equip children with the knowledge and tools for a lifetime of good oral health.
The SMILES program comes in and takes care of everything for us. We do nothing but sit back and enjoy seeing our kids getting taken care of. They work the schedule, they gather the students as they're needed.
And they go in there with equipment, with education, with toothbrushes, and they have treated thousands of children.
These children generally have full erupted permanent 6-year molars that are ready for dental sealants. 6th grade students receive oral health education and information on the dangers of chewing tobacco and oral piercings. In a 2-year research project, after SMILES was started in designated schools, severe decay rates of low-income children fell from 16% to 9% between 1994 through 2001. They also found that 40% of the 6,000 students served annually received one or more sealants, preventing decay in the chewing surface of the teeth sealed. Children who are involved in the SMILES program demonstrate significantly higher oral health knowledge than students who have not had the program. The first session is dental health education. DHA hygienists, dental assistants, and community volunteers use scripted dialogue to teach good oral hygiene habits to students.
We teach them the correct way to brush and floss to effectively remove plaque, because even though somebody brushes their teeth doesn't mean that they're removing the plaque effectively to prevent decay or prevent gum disease. So we teach them the proper way to floss and brush. We talk about healthy snacks versus unhealthy snacks to try to prevent decay as well,
including proper tooth brushing, good diet choices, and the importance of placing dental sealants to prevent tooth decay. Each child receives a toothbrush.
They're really excited when we come into their classroom. They're getting a new toothbrush. Maybe their toothbrush, we ask them a question about whether, how long should you keep your toothbrush? Oh, a year. And it's like, no, 3 or 4 months. So basically, they're very excited. They're very eager to learn. And they always want to tell you all kinds of stories about their mom, grandma, or, their sisters or brothers that have all kinds of cavities and they don't have any. So they're really excited.
The second session is oral screening. Volunteer dentists assist DHA staff in doing an oral health screening of each 2nd and 3rd grade student. The status of the children's oral health is sent home in written form in English, Spanish, or Vietnamese to the parents and to the school nurse for follow-up. Children with needs will be referred to their local dentists. And those who cannot afford private care may access the Allen Sachs Dental Clinic for free treatment.
The parents are excited that we're here performing a service for their children. They don't have to take off work to take them to the dentist. They're getting free sealants, getting education, maybe making the kids brush their teeth a little bit more for even a couple of days, a few weeks, or maybe a lifetime.
The third session is dental sealants. Children screened and found to have healthy permanent first molars are eligible for dental sealants. Students who return the signed parental permission form may participate in the sealant project at school. DHA staff set up portable dental equipment on campus and apply the sealants free of charge. Sealant placement takes approximately 16 minutes per child. During the sealant project, 2 children will be present at one time so that one child may be treated while the others observe. This is done to educate the students about dental procedures and to alleviate their fear.
The kids smile more. I think, as with any student, when they first come in, there's a bit of a fear factor, but the staff is excellent about putting them at ease, and they walk out all smiles. So we've been real pleased with that.
Very gratifying. It's wonderful to see the kids. I love working with the children. They're so excited when they see you come in, and maybe you've been at their school a few days and you haven't got to their classroom yet, and when nurse lady, when are you going to come to our classroom? You know, they're really excited. Some of them are kind of scared, but we talk them through it, and most of the time, probably 99% of the kids have the sealants done.
Dental Health Arlington has received widespread recognition for its exemplary programs and innovative approach to dental care for low-income people. As the result of a 2-year research project, Smiles was named a national model in Washington, D.C. for its ability to improve access to care and reduce tooth decay with a simple and cost-effective program. The American Dental Association awarded Smiles its Meritorious Award in Community Preventative Dentistry. The judges stated that they were impressed with the scope of the project and the dedication to promoting oral health as a necessary component of comprehensive healthcare services. The International Association of Junior Leagues presented Dental Health Arlington the Community Impact Award. This international award is presented to organizations which have made major strides in creating collaborative solutions to community problems. President Clinton presented Dental Health Arlington the President's Service Award at the White House in Washington, D.C. At the ceremony, a special commemorative medal for the Points of Light Foundation was given to Dental Health Arlington to recognize the Dental Health Arlington volunteers for their contributions and achievements.
It has been a great ride helping these people out, being associated with true professional people.
And that's what we try to tell the children, you know, even though mom and dad may brush their teeth every day, they may not be brushing the right way. So your homework for today is to go home, teach mom and dad, maybe brothers or sisters, how to brush their teeth the right way.
Children, adults that have gone through the dental clinic and the Smiles program with the children especially, it's been a remarkable 10 years. And those statistics add up into an amazing group of people that would not have been treated if it wasn't for this dental program.
10 years down, another 100 to go. That's what I say.
Dental Health Arlington would like to thank all of its supporters for their many contributions over the past decade. We look forward to working with you for many more years to come. We also welcome new supporters to become partners with Dental Health Arlington. Your volunteer and financial contributions will be gratefully received and carefully appropriated to meet the needs of low-income dental patients.